Gout is a chronic inflammatory type of arthritis. There are two types of gout. Both are caused by high levels of uric acid or hyperuricemia. Now, there's a primary and a secondary form of gout. Primary gout is caused by the patient just has a the patient's body just metabolizes uric acid a lot. Okay, so the patient, you can also say it's hereditary. It goes in the family. That they just make a lot of uric acid for some reason. Okay, so that's primary gout. Secondary gout is caused by either medications or because of their diet. Diet high in purines cause hyperuricemia, namely meat, red meat specifically, like beef, for instance. Um, we also have shellfish, organ meats. Okay, anything that's red meat, including especially organ meats, are very high in purine or uric acid. So here's the rationale for the patient's manifestations. As uric acid levels rise, then the patient will have these uric acid crystals, urate crystals, deposited in the peripheral joints, namely the toes. Sometimes it will affect the fingers, but mostly the toes. Okay, so by gravity, they tend to settle down in the bottom of the body, which means that the large toe, the big toe, is often affected. So there will be acute attacks will cause severe inflammation and swelling of the toes, especially again of the big toe. Okay. So it can occur really fast. So let's say they had a party. Most of my friends that are Muslims have gout. Okay, so two of my um, mechanics are both Muslims. One of my brother's business partners that back in the Philippines were Muslims also, and they all have this very common problem of gout. Okay, especially around the holidays, for instance, after Ramadan, for instance, when they have these huge parties, okay, where there's a lot of beef, okay, a lot of meat involved, and sometimes uh, um, um, shellfish as well. So the patients will pay for it the next day. So when they wake up the next day, oh, their toes are already very swollen, okay, and then they cannot walk. Okay, they stay in bed.
The salt in the meat?
No, because of their uric acid. Okay, high levels of uric acid. With repeated attacks, the patient will form tophi. Okay, tophi are like nodules, okay, present in the toes again. They can also have kidney stones, uric acid stones, okay, which can add to the problem. The medications linked to gout are diuretics, specifically thiazides and loop diuretics. Baby aspirin can also cause hyperuricemia, as well as ethanol, which means alcohol. Already described the manifestations. The patient's main complaint is pain. The toes are very, very inflamed, very tender, very red, very swollen. Patients will be bedbound. Okay, it's very difficult to put anything on, can't put socks on, can't put shoes on. It's very, very painful. So it can be debilitating. Let's go now to management. So what will the patient receive? So first of all, the patient will be placed on, if it's an acute gouty arthritis attack, the medication used will be colchicine along with NSAIDs. The choice NSAIDs are indomethacin, or they can also be placed on steroids. Okay, this is all for just the pain management. Okay, colchicine is very nephrotoxic, meaning the patient will be only on colchicine for a limited period, no longer than 2 weeks. Okay, because of the harm that it can cause to the kidneys. Okay, so patient will be placed on colchicine for pain management. Usually, after a few doses, it's enough to relieve the symptoms. So we hardly see patients on colchicine for more than 2 weeks. Usually, 2 weeks is enough. The pain will subside, and then after that, the patient will be placed on xanthine oxidase inhibitors to prevent the further formation of uric acid. The number one example here is allopurinol or febuxostat. Okay, between the two, allopurinol is more popular, right? Um, Along with medications, the patient has to modify their lifestyle, of course. So avoid alcohol, avoid aspirin if possible, avoid thiazide and loop diuretics, and then the purine-rich foods, which we mentioned earlier. So the red meats, especially red organ meats, okay, and again shellfish. So what are examples of shellfish? Shrimp, prawns, okay, including crustaceans. Okay, so anything with shells or yeah, they're all shells, right? Okay. And here's a drug chart. How long again are we placing the patient on colchicine? How long? 2 weeks maximum. Okay. And teach the patient to increase fluid intake while on this medication. That will help decrease damage to the kidneys. Probenecid is also another option. And here's allopurinol and febuxostat is for maintenance. So the patient can be on allopurinol indefinitely, meaning if the patient has primary gout, then they'll be prescribed allopurinol forever. But colchicine, when is colchicine used? Only during? Okay, during an acute gouty arthritis attack. So here are other non-pharmacologic interventions besides avoiding red meat, organ meats, and alcohol. Is the avoidance of trauma and stress as well. Oh, I forgot. If the patient, because some patients are refractory, meaning the patients do not respond to colchicine and allopurinol, okay, another reminder. Patient must not be taking colchicine and allopurinol together. Are we clear? Okay, they should not be taking them at the same time. So it's either colchicine or allopurinol. So when is allopurinol used? Maintenance. Okay, yeah, maintenance to maintain, to prevent an acute attack. When is colchicine used? During an acute attack. Are we clear? All right. So for patients who are refractory, meaning we use probenecid, indomethacin, steroids, colchicine, patient still has unrelieved pain, then the patient will be given pegloticase. This is given only in the hospital because this drug has the possibility of causing an allergic reaction. So we do not give this at home. Are we clear? Okay, so only for hospitalized patients. Are we clear? All right. And that's it for gout.